Hello, welcome to the February 2026 Social Listening Summary. I'm going to get right into it. All right, so February's media landscape points to what several past monthly summaries have already indicated, which is that people right now are living through a moment of like deep loss and pessimism, yet there is a growing push to rebuild civic life, reorient systems towards well being, and fund beyond crisis. All right, so first up, I called this theme a mortality and optimism crisis that is structural and not inevitable. So, several articles from February underscored how Americans are dying too young while also losing faith in the future, which the articles really emphasize that these are data points that are both rooted in policy and systems design choices. So, the New Republic article notes that if the US had mortality rates similar to its peers, more than 1 million deaths in 2020 and a little over a million deaths in 2021 would have been prevented, with about half of those deaths occurring under age 65, which translates to over 25 million years of life lost in 2021 alone. This piece traces the divergence in US life expectancy back over 40 years, tying it to the dismantling of social safety net, structural racism, economic inequality, underinvestment in public health, and deregulation that has exposed communities to unsafe working conditions, unhealthy food, environmental toxins, gun violence, and opioids. Then in Gallup's latest well-being polling, it showed that only about 59% of US adults now expect to have a high quality of life in 5 years. This is the lowest optimism level since this metric began. And it also indicated that satisfaction with current life is also near historic lows. However, there were some pieces like the WKBN story about a program for grieving teens in Mercer County, Pennsylvania, that really serves as like a concrete example of how communities are trying to mitigate the human toll of this crisis at a ground level, specifically around loss in this program by creating spaces for healing and belonging, even while all these national indicators are looking so grim. So a takeaway here is that the data is showing how the US is facing this like dual crisis of premature death and plummeting optimism driven by longstanding structural decisions. Um, and this just really reinforces how it's necessary to advance the vital conditions, which was named explicitly in the WKBN story as the basis for the grief program. And it really underscored how any meaningful responses to what is occurring right now must address like racism, inequality, and social protection as core health and well-being issues. Next up, reclaiming citizen belonging and civic muscle in a low trust era. So several articles from February call for rebuilding civic identity and capacity as a response to polarization and democratic anxiety. Again, themes that I've mentioned several times in previous recordings. The Inland Empire's belonging and civic muscle cohort came up. They're convening 10 to 15 cross-sector teams across the region over the next 10 months to learn, practice, and innovate together. This is all centered on belonging, bridging differences, and building civic muscle for the common good. They're doing this through immersive learning labs, peer connections, and a capstone harvest session that's aligned with a regional summit. This like really signals long-term investment in relationships and shared narrative and a local civic infrastructure rather than one-off projects. Harry Boyd's commentary plus a few other pieces on like new civic futures argue that the word citizen should be understood as like an active relational role, people who are co-creating public life rather than a legal status or a consumer identity. And that reclaiming this role is so essential in a time when words like democracy and authoritarianism are like contested or triggering for so many Americans. So a takeaway here is that even as trust and optimism erode, there is an intentional movement to rebuild civic muscle and a richer sense of what it means to be a citizen, and that being like a shared practice of problem solving and belonging. Communities are reframing civic life from something done to people to something done by people and with people. So these pieces really support that notion that investments in civic infrastructure, like relationships, narrative, local leadership, are not like peripheral, but central responses to democratic and health challenges and issues. Next up, or lastly, moving philanthropy and measurement from crisis response to long-term well-being. So A lot of pieces from February called out short-termism in both philanthropy and how metrics are being conducted, arguing that we need to stick around after the crisis and measure what makes life good, not just less bad. The SSIR article, Meeting the Moments After This One, talks about how philanthropy shifted after the murder of George Floyd, to center equity and to fund communities with more flexibility, but warns that when headlines fade, funding and attention often fade as well, leaving communities to rebuild alone. So the piece calls for funders to identify their superpower and commit to the long term, the long haul. And what that looks like is sharing lessons across regions, providing more like multi-year general support, and investing in leadership and building narratives and cross-sector partnerships so communities can adapt as conditions change or attention fades. Sean Ginwright's piece, Why Measuring Less Bad Keeps Us from Building Something Good, critiques a deficit only mindset, so very in line with like asset framing, but in evaluation, arguing that focusing on reducing harm without measuring belonging, joy, power, and possibility locks institutions into managing and solving problems rather than increasing the conditions for thriving. So the takeaway here is like a clear call to evolve from crisis only philanthropy and deficit metrics and ask funders to sustain flexible multi-year support and measure whether communities are actually able to thrive. Looking at belonging, power, and possibility, not just whether the worst outcomes have been reduced. This really ties into the like Great Stride goal we're embarking on, which is directly related to metrics around thriving. So it's really encouraging to see these shared mindsets in these pieces and amongst our peers. Together, these themes are all telling a coherent story that the U.S. is facing a preventable mortality crisis and deep civic pessimism that's rooted in long-standing structural choices, but communities are responding by rebuilding belonging and local problem-solving capacity. Philanthropy and systems leaders are being called to support this renewal by investing in long-term civic and health infrastructure and to measure thriving, not just alleviating harm. So thank you for tuning in, and I'll see you next month.